Okay, good morning, student. Can you hear me?
Yes, ma'am. Yes, ma'am.
Okay. So today we will be having a revisions on obstructive uropathies, no? Which I have already like explained, showed you all the slide, and even we have completed a revision. So today we will have a testing on this obstructive uropathies. Okay, I'll be testing your knowledge as your exam is approaching. I just want to know how much knowledge you have about this. So all of you on your video. Okay, hurry up. Please don't waste time, okay? The more you will waste time, the more like we have to take for a longer period of time your class. That's why you just on pass. Okay, Ishan, tell me the definition of obstructive uropathies. Your exam is very near. Obstructive uropathies. Loudly and slowly so that it should be audible. Astridina, please keep on looking, okay, all those tabs and Ishan, tell me what is obstructive uropathies. Many already explained earlier.
When the kidney cannot flow through the ureters and ureter, bladder, and the kidney, it's obstructive uropathy.
Are you sure, Ishan?
Yes, ma'am.
Okay, okay. Okay, Srijana, can you please tell me what is the definition of obstructive uropathy?
Obstructive uropathy is when urine cannot flow through the kidney, bladder, or urethra due to some type of obstruction.
Okay, good. Nowadays, so many students, they keep on saying network issue, network issue. Now, though, I won't believe anymore. If one say network issue, they share screenshot, the other also will follow the same thing. It's totally unbelievable. Okay, so Darshana, would you like to explain what is obstructive uropathies?
Hello, ma'am. Hello, ma'am.
Yeah, what is obstructive uropathies? All of you see once again, okay? What is obstructive uropathy? So obstructive uropathy is when your urine cannot flow, okay? Either partially or completely through ureter, through your bladder or urethra, okay? Why it cannot flow to your ureter, bladder or urethra? Why it cannot flow? Because due to some type of obstruction, because there is some type of obstruction present, okay, in your ureter, in your bladder and your urethra. That is the reason why your urine cannot flow as to how it should flow. So instead of the urine flowing from the kidney to the bladder, okay, the urine will flow backward or refluxes into the kidney. Means like kidney to the bladder, it won't flow. Instead, it will flow backward. Okay, there will be a reflux into the kidney. So that was all about the definitions that we could find in obstructive uropathies. So are you clear?
Yes, ma'am.
All of you, are you clear?
Yes,
All of
ma'am.
you, very easy, okay? If the definition comes in your exam, so don't get confused. Are you clear? It's very easy. All of you?
Yes, ma'am.
Okay, so let's move to the next. So next was the causes of obstructive uropathies, okay? There will be an enlarged prostate, there will be a kidney stone, because obstruction ka matlab kya hai? Blockage is not it. So what will be the causes of all those obstruction? Okay, uska kya cause ho, kya karan ho sakta hai? Maybe because of the enlarged prostate, maybe because of the kidney stone, maybe because of the urethral stricture, maybe because of the uterine cancer. Okay, now let us discuss some of the most common causes of obstructive uropathy. Okay, these are the most common causes. So the common causes, please listen nicely, I will ask one by one. The common causes of obstructive uropathy are bladder stone. So that means because of the presence of stone in the bladder, okay, there can be obstructive uropathies. And because of the presence of stone in the kidney, there can also be obstructive uropathy. It may be because of the benign prostatic hyperplasia. There is enlarged prostate, okay. So what do you mean by benign? Benign. What do you mean by benign? Okay, get ready, okay? Later on I will ask. So there will be a blood because of the bladder or urethral cancer, okay? If there is a cancer in your bladder or if there is cancer in your urethra, okay? So that can also lead to obstructive uropathies. And then if there is a cancer in your colon, and if there is a cervical cancer, if there is a uterine cancer, means bladder cancer, urethral cancer, uterine cancer, and if there is any kind of problem, okay, with the nerve, okay, that supply the bladder. So if there is any problem with the nerve that supply the bladder, then this can also be the causes of obstructive uropathy. So what do you mean by benign? What do you mean by benign?
Tumor.
Ma'am, non.
What is benign? If you don't know the answer, I'll pass to Divyajit. What is benign? Okay, I could see Darsana message. It's a tumor. Okay. Divyajit, can you please tell me what is benign?
Ma'am, non-cancerous tumor.
Not non-cancerous. Okay. Baboglang, is it correct? Divyajit said it's benign means non-cancerous. It's a tumor, but it's a
Yes,
non.
ma'am.
Is it correct, Baboglang?
Yes, ma'am. Yes, ma'am.
Very good. Okay. Divyajit. Okay, so we will move on. Okay, so now I have discussed you all about the definition. Okay, obstructive uropathies hota kya hai? I have already explained very nicely, and then after that we have discussed about the some of the causes. Okay, and even we have discussed about some of the common causes. Because of what reason there can be obstructive uropathy? So what were the causes? Tell me one by Girija. Tell me one causes. Hurry up.
Bladder stone.
Okay, Malvina, tell me one causes. One by one.
Ma'am, kidney stone.
Okay, Virginia, tell me. All of you, it's not the time to say I don't know, okay? Virginia, tell me one. Hurry up.
Benign prostatic hyperplasia.
Okay, that means what? In bracket, what did I give you, Virginia?
Enlarge of prostate.
Yes, very good. Okay, Rasmi, next causes. Hurry up.
Ma'am, bladder and uterine cancer.
Okay, very good. Okay, good. Finisha?
Colon cancer.
Finisha loudly.
Colon cancer.
Okay, very good. Okay. Monica, can you please tell me one causes?
Cervical cancer.
Can you please say again, Monica?
Cervical cancer.
Okay. Shelly, can you please tell me one?
Then uterine cancer.
Okay. Senkamchi, can you please tell me one?
Main problem with the nerve
Uh,
by the
okay.
bladder.
Okay. Can you please tell me the full nicely? Say nicely.
Problem with the nerve that supply the bladder.
That supply the problem with that supply the.
Bladder.
Okay. Good. Okay. So let's move on. So don't forget. Okay. Yes, sir. Exam mein aayega. Don't forget. Okay. Next. Coming to the next point. So after that, we have the symptoms, okay? We already know the definition. We already know the causes. Now we will focus on the symptoms. अगर किसी का ऑब्स्ट्रक्टिव यूरोपैथीज हुआ तो उसका शरीर पे क्या क्या सिम्टम्स, क्या क्या चेंजेस दिखाई देगा. So if someone have obstructive uropathy, we will be discussing what type of symptoms he or she can face. So let us discuss one by one. So the symptoms of obstructive uropathy include, there obviously if there is a obstruction, okay, if there is an obstruction in the bladder, in the urethra, in the utera, means wherever there is obstruction, okay, in the urinary system, then there will be like hematuria, okay, there is presence of blood in the urine, क्योंकि वो obstruction का वजह से bleeding भी हो सकता है ना. So the blood in the urine. And then there will be decreased urine output. So obviously obstruction होने से क्या होगा, means the amount of urine that can be excreted now, that will be less, okay, there will be decreased urine output. So if there was no obstruction, okay, then what was the normal urine output that we human being excrete every day? Can anyone tell me?
Urine.
Yeah, say Darshana, say.
Urine.
What? Pardon? I could not hear. I could not hear. Okay.
Urine, ma'am.
Okay. Ilasara, can you please? Not Ilasara. Okay. Okay. Ilasara, can you please tell me what is the amount of urine that we need to excrete every day? Normal urine output. I'm just asking the normal. Some important terms to remember. I gave you all, na? Okay. Sujana, can you please tell me?
Ma'am, 5 to 6 liters per day.
Can you please tell me the answer?
Ma'am, 5 to 6 liters per day.
5 to 6 liter per day. Okay, all of you go and done when I discuss you all about the this acute renal failure. Na, I have given you some important terms. Go and check out once your copy. And after that you inform me. All of you see the important terms I have given you one. Okay, so the next is fever, and there will be a frequent urination, and then there will be a nausea or vomiting and flank pain, and there will be a edema, there is swelling of the hands, feet. Obviously अगर किसी का ऑब्स्ट्रक्टिव यूरोपैथी हुआ ना, तो उसका क्या होगा कि यूरिन जैसा फ्लो होना था वैसा फ्लो नहीं होगा. तो if the urine is not excreting, तो यूरिन एक्सक्रीट ही नहीं हो रहा है, तो शरीर पे जो फ्लूइड ही एक्युमुलेट हो जाएगा ना, तो उसका वजह से एडिमा होगा. So if someone have obstructive uropathy, there will be some decrease in urine output. Now, if there is decrease in the urine output, then there will be lots of fluid accumulated in our body. Now, if there is accumulation of fluid in our body, then that can lead to edema. That is swelling of our hand, swelling of the feet, swelling of arms, and or else legs. Or else it can be the whole body edema. So the whole body edema is known as what? Babogla? Whole body edema is known as? There is edema in, there is edema in your whole body. What name, what medical name would you give for that? If you don't know, I will pass to someone else. Just say yes, you know, or you don't know, that's all.
No, ma'am.
Okay, no problem. Okay. Darshana, can you please tell me the answer?
Anasarca.
Yes, very good. Anasarca. Okay. If there is like if there is the whole body edema, then it is known as anasarca. Okay, Baboglang?
Yes, ma'am.
Okay. So that swelling can also occur, okay, if someone have obstructive uropathy, and there will be weak or slow urine stream. Okay, obviously when there will be like obstruction, okay, you might pass the urine, but the urine stream might be very slow. You might pass the urine very slowly, okay, and there can be dysuria. Dysuria means it is a burning sensation during micturition, okay, or urination. So this was all about the symptoms. So are you clear with the symptoms, all of you?
Yes, ma'am.
Okay, rich person, now can you
Yes,
please
ma'am.
share your idea about the symptoms? Rich person, please don't waste time. Rich person, can you hear me?
Yes, ma'am.
Okay, so tell me the symptoms of, if someone have obstructive uropathy, what type of symptoms you could find? Say, share. All your friends are waiting.
Mm,
This person, say. I am 100%, 200% sure that you know the answer. Just say. Hurry up.
I don't know what to say.
Hurry, just now I explained. Where were you?
Ma'am, I joined. I gotta get
Okay,
time, ma'am. That's fine.
okay, this person, you can type the answer in the this one. If you have network issue, then you can type the answer in the message. Okay, Rudolph, share me the answer about the symptoms. अरे मैंने अभी तो explain किया ना. Rudolph, say. Mr. Rudolph, playing PUBG?
Yes, ma'am.
Yeah, say.
No, ma'am. Blood in urine,
Yes, very good. Then,
decreased urine output,
yeah, then,
feeling as if the bladder is never empty,
yes, and then,
and fever, frequent urination,
okay,
nausea or vomiting,
okay,
flank pain,
yes,
swelling of hands, feet, arms, and legs, weak
okay,
and slow urine stream, and
okay.
dysuria.
So what is dysuria, Rudolph?
Dysuria is a burning sensation during urination.
Oh, very good. Okay. Okay, next let's move on. Okay, so after the symptoms, what did we discuss, Rijana?
Diagnostic evaluation.
Okay. First, before asking you all, let us just see, look it back, okay? And then I will ask you all. And I have explained the diagnostic evaluation very nicely. So you just see, okay, diagnostic evaluation. So catheterization may be done immediately, okay, after voiding to determine the amount of residual urine in the bladder. Means catheterization may be done immediately after voiding to determine the amount of residual urine in the bladder. So like, because in some person, like what was the definition? What was the definition that we have discussed? In the definition, you have find that obstructive uropathy means it is when your urine cannot like flow partially, like, or else it can't flow completely, okay, through your ureter, like to your bladder, or else to your this to your urethra. So that was the definition. It's not it. So it was mentioned in very nicely in the bracket, partially or completely. Means urine cannot flow partially. Means if the urine flow, but the flow of the urine might be partially, thoda sa, or else urine flow jo hai na, wo it might totally stop completely. It might not flow completely. So that was what we have seen. So in that cases, what happened is that we need to do this catheterization. The urine ureter ka through when the urine doesn't pass na, so that time we do this catheterization. So and then catheterization is also mainly done, okay, to determine the amount of residual urine, the amount of urine that is presence in the bladder. And then next is intravenous urography. Okay, this intravenous urography, it is mainly used to visualize urinary tract and to measure the renal excretory function. So this is the name of the diagnostic evaluation that is performed, and it is mainly performed to visualize our urinary tract. Okay, हमारा urinary tract, it might be upper urinary tract, it may be lower urinary tract. So this intravenous uropathy helps us to visualize. That means देखने को मौका मिलता है to use to visualize urinary tract and to measure the renal excretory function. जो renal excretory function है ना, it measures that with the help of this intravenous urography. And then next is cystoscopic examination. I already explained you all this. And next is urine culture. So urine culture also I already explained, no need to repeat again. Next is the blood test. So through all this diagnostic evaluation or through all this investigation procedure, you can diagnose that someone is having obstructive uropathies. So now let me ask one by one. So what are the diagnostic evaluation of obstructive uropathy? Rashmi, can you please tell me the 1 point?
Yes, ma'am. Ma'am,
Yeah.
catheterization may be done immediately after voiding and determine the amount
What do
of
you mean by
residual urine
voiding?
in the bladder.
Here it is written, catheterization may be done immediately after voiding, right? So what is voiding? V-O-I-D-I-N-D, after voiding.
Ma'am,
दिमाग में क्या आया, जो भी हो बोलो. If it's wrong also no problem, just catheterization करना है ना after voiding ना, तो voiding तो जानना पड़ेगा. You have to know ना what is voiding.
ma'am, drain away.
Pardon, Rasmi, what did you say?
Ma'am, drain away.
I think the network, I could not hear properly. Okay, no problem, Rasmi. Okay, no problem. Virginia, can you please tell me what is voiding? Virginia, can you please tell me voiding? Because after voiding only, now you will have to do catheterization. So if you won't know, if you don't know the answer, Dibyajit will tell the answer.
Then no, ma'am.
Okay. Oh, I forgot. Rich person, can you please tell me what is voiding? Rich person? Sleeping?
Yes, ma'am.
Yeah. Tell me what is voiding.
Discharge or drain, ma'am.
Pardon?
Discharge or drain.
Oh, okay, good. Rudolph, can you please tell me what is voiding? Mr. Rudolph? Hurry
Yes,
up.
ma'am.
Yeah, what is voiding?
Voiding. It is
Please.
charge.
It is a?
Discharging
Yes,
or
yes.
drain away.
What you will discharge?
Urine.
Okay, very good, Rudolph. Okay. Voiding means you can simply call na urinating. So simple. Just say urinating. So micturition, voiding, yes, urinating here. So catheterization may be done immediately after voiding, okay? In order to determine the amount of urine in the bladder. So just to determine na bladder mein kitna urine hai, just to determine that they need to do this catheterization. So that was the first point. So what was the name of the method that is used to visualize urinary tract? Prakriti, what was the name of the method that is used to visualize urinary tract? Visualize means जो देखते हैं. Okay, Lasara, tell me.
Intravenous urography.
Very good. Intravenous urography was the method, okay, that is used to help us to see or to visualize our urinary tract, okay? And then what was the three diagnostic evaluation? What was the rest three diagnostic evaluation that I gave you all, Darshana? Tell me one.
Blood test, ma'am.
No, tell me the third one. Blood test is correct.
Stethoscopic examination.
Tell me again once more.
Stethoscopic examination.
You see, that's what I want to see, all of you. The pronunciation, okay? Cystoscopy. Try to pronounce cystoscopy, okay? Darshana, say once.
Cystoscopy.
Yeah, cystoscopy. Okay, all of you improve your pronunciation. It's cystoscopic. Okay, cystoscopic examination. So, Baboglang, what culture can be done in order to diagnose obstructive uropathy?
Urine culture.
Okay, very good. Okay, let's move on. Okay, Srijana, please take attendance. Okay, let's move on. Coming to the next, after diagnostic evaluation, what we have next is the management. Okay, so if someone have obstructive uropathies, okay, how can you manage? So the management is done through surgical correction. Okay, it is done through surgical correction. So obviously when there is obstruction, if the medication doesn't work, so the main method is to perform surgical correction, that is surgery. Surgery करके obstruction को remove करते हैं. So what are the name of the all those? Okay, the surgical correction. That is, you can perform nephrostomy, and then with the help of this nephrostomy, you can manage, okay, these obstructive uropathies. And with the help of lithotripsy also, with the help of urinary catheterization also, with the help of ultrasound, and any kind of, and if any kind of infection is occur, okay, if any kind of infection is found because of that obstruction, okay, then you can control that infection with the help of a medication known as antibiotics. So these were the management that, and I already explained to you all one by one everything. What is nephrostomy? What is lithotripsy? All of you remember now what is lithotripsy? Lithotripsy, Shelly? What was lithotripsy, Shelly? If you don't know, I'll pass the questions to Malvina.
Ma'am, I don't know.
Okay, Malvina, tell what is this, because I explained. This is not the time to explain again because I already explained. I want to check your knowledge.
Ma'am, it is a medical procedure.
Yes.
Hello, ma'am. Medical procedure, shockwave laser to make breaking down into smaller particle of obstruction.
Okay, good. Okay, Virginia, can you please share your idea in a simple way?
There is stone in the kidney.
I'm asking the process of lithotripsy.
Yes, ma'am. There is stone in the kidney. Shock or wave.
Okay, who can tell me? Ishan, can you please tell me what is lithotripsy nicely? The class is almost going to end. Ishan? Ishan is absent. Ishan, you share your friends what is the answer nicely. Lithotripsy in a simple way. Ishan, say. Because lithotripsy का through ही तो manage करोगे ना. If someone have obstructive uropathy, so what is obstructive what is lithotripsy? Shall I pass the question to someone else? Ishan? Okay. Rudolph, can you please share the answer? Lithotripsy?
Ma'am, breaking down the stone into smaller pieces.
Very good, yes, Rudolph. I did not expect. Very good. Okay. Breaking down the stone, because obstruction means what? There is a presence of the stone in the bladder, in the ureter, or in any urinary tract, okay? In any part of your urinary tract. So this lithotripsy, this is the procedure. This will help you, this will help the stone to break up into small pieces, okay? If it break into the small pieces, what happen is that small stone, it might that you can it might directly pass, okay, you might directly be able to excrete it out. That is why it is break into small pieces. So that is just what you need to know is that it is, you just write down, it is a procedure that is that uses the shock wave, okay, they use the shock wave to break up the stone into the into small pieces. Okay, so what was the next diagnostic? Urinary catheterization, you all always, and catheterization, when it comes about catheterization, okay, there are so many catheterization, but nowadays in this generation, what catheterization we mainly use is Foley's catheterization, okay, Foley's catheterization. Foley's catheter, Foley's catheter. The name of that catheter is Foley's catheter. Foley's catheter. You can write down if you want to write down Foley's catheter. F-O-L-E-Y, okay? C-A-T-H-E-T-E-R. F-O-L-E-Y, Foley catheter. This is just the name of the catheter. So this catheter, this Foley catheter, okay, this it is very much helpful. It is a very thin, okay, and it is sterile. It is a sterile tube, okay. It is to be kept inside the packet, okay. It is very sterile, and after putting the gloves only, this is being touched. It is a thin sterile tube, okay. It used to be inserted into your bladder, okay. Why this is inserted into the bladder? In order to drain out the urine, okay. So that is why this procedure is very much helpful. You can just write down in bracket. It is inserted into the bladder in order to drain out the urine, that much. It's very simple. Okay, so the next is ultrasound. Ultrasound is very common, no need to explain again. Or any kind of antibiotic, like Sankamji already said, so many antibiotic yesterday. So if there is any infection, then you can offer them the the antibiotic, because while performing some surgical procedure, like that is while performing the lithotripsy or nephrostomy, or while putting the urinary catheterization, when the catheter is inserted in the bladder, in that cases, because of some, like because of how to say, because of some like unpracticed, like means when the unskillful physician and all, now when they perform, what happen is that that might cause infection, okay. If the person is not skillful, that might cause infection. So in that case, you can directly prescribe this antibiotic in order to heal that in a primary stage, or it's in an early stage. So what was nephrostomy? That was also the management, right, for obstructive uropathy. Nephrostomy. What was nephrostomy? Nephrostomy. What is nephrostomy? Divyajit, what is nephrostomy? You have any idea? If no, no problem. Divyajit, nephrostomy. If you don't know, Girija will tell the answer.
Hello, ma'am.
Yes, Surajit, I can hear you. Nephrostomy क्या है? Any idea?
मैम इसका मतलब जो फ्लूइड जमा होते हैं बॉडी में उसको
say.
मतलब पाइप से निकाल रहे हैं वो मतलब I can understand, but
okay, at least you have idea. Okay, no problem. Okay, Srijana, can you please explain what is nephrostomy? There are some students trying to join now. Oh God, they think I will accept. Srijana, can you please explain? Hurry up, only 1 minute left. Nephrostomy. Okay, no problem. Okay, nephrostomy. Okay, nephrostomy means in nephrostomy, this is one procedure. Okay, it is a procedure where between your kidney and the skin, okay, an opening is made between the kidney and the skin. One opening is made, okay, with the help of surgery. Opening is made, and through that opening, the urine is being drained out. Okay, the urine is drained out from the kidney. So kidney or skin ka beech mein na ek opening, they used to make one opening, okay, where you can drain out your urine, okay, from the kidney. Are you clear?
Yes, ma'am.
Okay. Okay, then that's